Welcome to Nursing Survival. Find me at nursingsurvival.com for nursing-related study guides, as well as a guide that goes along with this podcast. I have study guides that keep you engaged, such as fill in the blank and coloring pages. Today's topic is cardiomyopathy. This is a heart condition. Cardiomyopathy is a broad term that refers to an impairment of the cardiac muscles, the myocardium. The impairment leads to dysfunction of the heart. Depending on the form of cardiomyopathy, the heart muscles are either thinned or thickened, and the ventricles of the heart cannot adequately pump the blood to the body. In dilated or congestive cardiomyopathy, the ventricles become stretched and thinned. They dilate or enlarge. It is usually seen in the left ventricle. Remember, the left ventricle pumps blood from the heart to the body. The ventricles cannot squeeze properly, which results in a decreased blood flow to the body. This is the most common form of cardiomyopathy. In hypertrophic cardiomyopathy, the heart muscles thicken and enlarge. Again, it's usually seen in the left ventricle. This reduces the size of the chambers, so the heart cannot hold as much blood. With restrictive cardiomyopathy, the heart muscles, usually the ventricles, become rigid, stiff, and less elastic. The heart muscles cannot relax after contracting, so that the chambers cannot properly fill with blood. It is important to remember the differences between the types of cardiomyopathy and how it might affect the body. Next, we'll review the causes of cardiomyopathy. Often the cause is unknown. Usually cardiomyopathy is the result of other conditions. Conditions such as high blood pressure, obesity, thyroid disease, diabetes, alcohol and drug use, infections of the heart attacks, and lupus can all contribute to cardiomyopathy. When the heart has to work extra hard to function, the structures and the muscles become remodeled. This leads to further dysfunction. Myocarditis is inflammation of the heart. It is often caused by viral infections or chronic inflammation. Genetic predisposition can lead to hypertrophic cardiomyopathy. Knowing how diseases affect the heart can help you link them to cardiomyopathy. Patients may have no signs or symptoms in the early stages. Signs and symptoms of cardiomyopathy include shortness of breath, dyspnea on exertion, or shortness of breath with movement, orthopnea, shortness of breath when laying down, fatigue, weakness, edema in the lower extremities, poor peripheral perfusion, irregular heartbeat, dysrhythmias, palpitations, tachycardia, a heart rate greater than 100 beats per minute, jugular vein distension, JVD. This is a sign of increased central venous pressure, dizziness, lightheadedness, angina or chest pain, extra heartbeat sounds, S3 and S4, crackles or rails in the lungs. This is short, high-pitched popping sounds. It indicates fluid in the lungs. Diaphoresis, which is sweating. Diagnosing cardiomyopathy involves several procedures. An electrocardiogram, an ECG, or an EKG measures the heart's electrical activity. It is a relatively easy test and is non-invasive. An echocardiogram is a test that uses high-frequency sound waves to visualize the heart. It will show the size, shape, and movement of the heart. It can allow medical providers to see abnormalities and changes in the heart and surrounding tissues. A stress test may be performed to help show how the heart is being supplied with blood and oxygen. During periods of stress, the heart needs extra blood and oxygen to properly function. Genetic testing may also be done. A chest X-ray may show heart and lung abnormalities, including structural changes and fluid in or around the lungs. Endomyocardial biopsy is a procedure where a small amount of myocardial tissue is examined. There is not a single test to diagnose cardiomyopathy. A combination of test and medical history is used. Cardiomyopathy treatment involves both medical and conditional influences. A large part is based on controlling symptoms and preventing complications. Lifestyle changes such as diet and exercise are encouraged. Patients are educated on quitting smoking and drinking, as well as reducing stress. Some patients may need a pacemaker, a device that helps control abnormal heart rhythms. Several medications are used to treat cardiomyopathy. Beta blockers block the sympathetic vasomotor response. They help lower blood pressure, decrease the heart rate, and decrease cardiac output. They decrease the workload of the heart and block bronchodilation. They often end with OLOL. ACE inhibitors decrease the sympathetic vascular resistance, decrease afterload, and dilate vessels. They often end with PRIL, P-R-I-L. ARBs vasodilate and decrease afterload. They often end with sartan, sartan. Diuretics decrease preload by removing excess fluids from the body. Anticoagulants such as heparin and warfarin prevent blood clots. Calcium channel blockers inhibit calcium from entering into the cardiac and smooth muscles. This dilates arteries and reduces afterload. Medications are important to remember for testing. Check out my other podcast for more detailed reports on each medication. Complications of cardiomyopathy include heart failure, cardiac arrest, arterial fibrillation. Blood clots are another complication. They can be caused by stagnated blood due to the ventricles being unable to properly pump. Valves can also not function properly, allowing blood to flow backwards. A clot can dislodge and travel throughout the body. It can travel to the arteries of the brain or lungs, causing a stroke. Death may occur. Nursing considerations for treating patients with cardiomyopathy include monitoring vital signs. This includes heart rate, blood pressure, and respirations. Also take the lungs and the heart sounds. Fluid can accumulate in the lungs due to impaired function of the heart. It may sound like crackles in the lungs. Patients with cardiomyopathy may also have extra heart sounds. Palpitate peripheral pulses and assess for rate and rhythm. Reduce stress as it can cause an increase in oxygen and blood demands of the heart. The patient may need fluid restriction to help decrease the volume of blood the heart has to pump. Cardiomyopathy may be the result of other medical conditions that require assessment, treating, and patient education. Patient education includes advising them on exercising and staying fit. They may need education regarding healthy food ideas, how to prepare foods, as well as foods to avoid. Exercise should be adjusted to the patient's tolerance. They do not want to cause additional stress to the heart. Maintaining a healthy blood pressure will help the body receive adequate blood and oxygen, and it will lessen the risk of further cardiac damage. Depending on the patient's condition, they may need to restrict their fluid intake. Educate the patient on how to add up fluid intake, as well as the types of fluid they might not realize should be counted. This includes ice cream, jello. Instruct the patient to reduce stress and get adequate rest. Patients will need their medications explained. Review their home medications, including vitamins and supplements. Medications may need to be adjusted, especially if this is a new diagnosis. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for more study guides. I'd love to hear from you. Please send me any topics you'd like to hear. More study guides will be coming out, so join my email group so you can be the first to find out. We'll also be having special promotions and giveaways. Thank you.